This is the Emergency Medical Minute, sponsored by CarePoint and HCA Health One.
All right, well, good morning, everybody. So we take care of a lot of asthmatics here. And, I think we all know that the kind of mainstay of treatment is albuterol, sometimes some other medications, and then hopefully get people better. And then, a lot of times we discharge people with a rescue inhaler to help when they get home and have symptoms. So for a long time, that was an albuterol inhaler, kind of a short-acting beta agonist. Sometimes we'll also send people home with an inhaled corticosteroid, something like Advair or other versions of an inhaled steroid that's more of like a maintenance treatment. Over the last couple of years, there's been some studies and guidelines that have suggested that combination beta agonist, so something like albuterol or another beta agonist, with an inhaled corticosteroid might actually be beneficial. It's actually recommended in the guidelines. It's not something that's done a ton, but there was a recent pretty large review that looked at patients who are, getting regular albuterol as a rescue inhaler versus these combination ones to see if it prevented severe exacerbations. And both what's called short-acting beta agonists like albuterol, and then also long-acting beta agonists, which last longer, in combination with inhaled corticosteroids, did reduce it. The short-acting combinations reduced the severe exacerbation by 5%, whereas the long-acting ones actually reduced it by 10%. So pretty significant kind of reduction, and that's very important, so patients don't have more asthma exacerbations, need to come back to the emergency department. So the long-acting beta agonist, the one that's used is actually called formoterol plus budesonide. And I've tried to start prescribing that for patients who come in for asthma and then need an inhaler to go home with. The one issue is that it can be expensive. Albuterol is still fairly cheap, and these combinations one can be expensive. But if patients have insurance, if they're able to get it, these things that we send them home with can be very beneficial. And it is the rescue inhaler. It's not like just, sometimes people just take their steroid one twice a day and they don't take it anymore. These combinations, the long-acting with the steroid, is what they use when they have an exacerbation. So it's kind of good to educate people that this is, instead of your albuterol, it's better, prevents more of these exacerbations.
Is that the Air Super?
I don't know the trade name for it. Formoterol plus budesonide. And then I'm not sure if Air Super, there's now a newer version is actually a short-acting with an inhaled corticosteroid. So the names are kind of complicated and kind of should keep track of what's what, but like most of the beta agonists end with like EROL, like albuterol, formoterol, and then the steroids are things like budesonide. And so sometimes we do have to look up just the pharmacy, but yes. Thanks, guys.
This has been the Emergency Medical Minute. Thank you to our sponsors CarePoint and HCA Health One. Support from them and listeners like you helps us to continue providing free medical education to the masses. If you found this episode valuable, consider supporting our work and check out the link in our show notes.